Hi everyone, I have another one of my exploring the mathematical curiosities of coronavirus stats. But before we get started, another reminder, I am not an expert, so don't listen to me for any advice on what's going on with coronavirus. In my previous exploration, I was looking at why the death rate amongst closed cases was such a bad estimate of the mortality rate. But today I wanted to try and go back to an earlier question, why they wanted to use this estimate in the first place. Now, the most obvious way to estimate the death rate is to take the current deaths and divide it by the current number of cases. And that's what I just did here with the figures from this morning. If you do that, do the maths, you get a calculation of the fatality rate of 5.4%. However, there's a problem with this logic. If we look at this reference here, it's saying that it takes about 18 days between someone getting symptoms before they unfortunately die. And so if we just take the number of cases today, that's going to include a number of people who are sick at the moment and are going to go on to die. So the argument is that it's underestimating the death rate. What we should really be doing is going back 18 days in the past and calculating the death rate based on the number of people who are sick then. Unfortunately, there's a problem with this logic because people don't become confirmed cases immediately when they show symptoms. There's a lag there as well. So what we really need is an estimate of how long from when people get symptoms to when they get the test confirmation and part of the official statistics. And to work that out, we can look at this awesome graph from the situation in China. On the yellow-orange bars, that's showing the official statistics of when those cases are officially declared and reported. So that's what we see when we look at the case estimates that are coming out today. However, the Chinese authorities also asked people when they first observed symptoms, when they were diagnosing them. And this allowed them to go back retrospectively and create the blue graph, which is showing the date that the patients first observed symptoms. And if we look at this, we can see some really cool things. So I've circled here when Wuhan city was shut down and another 15 cities the next day. Now, looking at the orange graph, there was no obvious effect of this, but when we look at the symptom onset graph, it basically slowed the spread almost immediately. The other thing we can do with this graph is get an estimate of the time between symptom onset and test confirmation, and from this Chinese data, it's about 10 to 12 days. So if we go back to our 18-day symptom to death average, and this new estimate of 12 days, or about 11 days, between symptoms and test confirmation, we see we have about a 7-day lag between symptoms and death on average. So we could use this to get a different way of estimating the mortality rate. We can take the deaths, in this case on the 3rd of April, and the cases a week ago on the 27th of March, and you use that to give you a mortality rate estimate of 9.9%. But then we look at this number, 9.9%, and compare it to the 1.2 to 1.5% estimate that actual experts are coming up with, and we see that there's a pretty big difference. So once again, the question is, what's going on? I posed this question to my family WhatsApp group and got a flurry of responses. Charles, who I should note is also not an expert, pointed out that the official number of deaths has a much lower estimate than the number of cases reported. Thinking about this, it seemed to make a lot of sense to me. It seemed pretty easy to work out whether someone is dead or not dead. On the other hand, to have a case reported, someone needs to have symptoms. They then need to meet the criteria for testing in their country. They need to go get tested. That needs to go to the lab. Then they need to get the results back. And of all these steps, there's things that they might fall down at. They might not notice their symptoms or choose to get tested. They might not meet the criteria. The country might not have enough testing facilities, or they might not have enough laboratory facilities, or they might be a bit slow in getting the results and announcing them. Then I saw this comment from Rach, who I should say is also not an expert. So it seems like death counts are a bit more tricky than I thought, but still a lot more reliable than case rates. So given that there's so much variation between countries in testing, I decided to look at the country-by-country figures to see what sort of patterns emerged. The first ones I pulled out were the ones with the largest outbreaks, and using Charles's observation, I based this on the recorded number of deaths, not the recorded number of cases. Now, these countries are important because they dominate the global statistics. When I added them together, they were representing 85% of deaths and 70% of cases. The other group I pulled out was some countries that had a reputation for being good at testing. So those ones were ones where we would expect that they would have more accurate data to give us an idea of the mortality rate. So the interesting thing about this data is that the countries with the largest outbreaks also have far higher mortality rates estimates, which probably indicates that they're not very good at testing. On the other hand, the countries who are reputation for good at testing, we can see that in their far lower mortality rates, but they also have far lower deaths. Now, this is not a coincidence. If we look at the advice that the World Health Organization have been giving, it's been pretty clear. We have a simple message for all countries. Test, test, test. Test every suspected case. One of the WHO's strongest pieces of advice for countries is that in order to avoid a major outbreak, they need to test and isolate all confirmed cases. The countries that are doing that well, we can see have low outbreaks, whereas the countries who ignored that advice or didn't implement it well have high outbreaks. But when it comes to looking at the global statistics, that means that the world numbers are totally off. They're dominated by these countries who didn't really listen to the WHO advice, have poor statistics and large outbreaks. So I decided to see what happened when you applied the 7-day lag estimate to these three countries that had good testing regimes. And what we see here is that we're getting about a 1.4 to 1.9% estimate for the mortality rate. And I think that's pretty interesting as it compares very closely to the 1.2 to 1.5% estimate that the experts were quoting earlier on. Now, either that expert estimate is a little bit out, but probably more likely is that there are still, even in these good countries, a number of undetected cases. Or I could be completely wrong and this is a total coincidence because, after all, I'm not an expert.